Hello and welcome everyone. My name is Dr. Jhanvi and today we are going to be doing a short and sweet topic in infectious diseases in anesthesia, and that is malaria and its anesthetic implications. So last week we did dengue and its anesthetic implications. Now these are all tropical infectious diseases which are very common in India. So you may encounter some patients who may have acute malaria or someone who has suffered from malaria in the past. So you should know what happens in malaria, what are the causative factors, what is the pathophysiology. And when you encounter a patient who has had malaria or is currently having malaria fever but has to undergo an emergency surgery, what are the things that you should keep in mind? And you should definitely ask in the pre-op phase. All right. So with that, let's start off with our main topic. So what is the meaning of the word malaria? So mala means bad and area means air. Okay. So why do we say, why was it called bad air? Because actually the disease is being carried. The vector that is carrying the causative agent is coming from the air, that is the mosquitoes. Okay. So what is the actual causative agent of this disease? So the actual causative agent of the disease or the parasite is the Plasmodium species. And this is a type of a protozoa. Okay. Now, this is the one that will actually invade into all the cells of the liver, RBCs of the human, and it will procreate, go through different stages, and it will actually cause the disease of malaria. Okay. But who carries this protozoa or who carries this plasmodium? It is carried by a vector. And we all know that this vector is female Anopheles mosquito. And where do we find this female Anopheles mosquito? So in our country, a lot of Anopheles mosquito is found. So the distribution of this Anopheles mosquito is mostly in tropical countries because they like to survive in warm, humid climate. So you will see that all the South Asian countries, malaria is quite a rampant disease over there. And especially when do you see that malaria happens is in this season from July to November. That is the rains season. Okay, that is the rainy season. You will see that there is a lot of proliferation of these mosquitoes. Now, can you get malaria just from a simple female Anopheles mosquito? Of course not. If just the Anopheles mosquito comes and bites, it is not going to cause malaria. It has to carry in its saliva the Plasmodium species. Okay, so only if it is the Anopheles mosquito already has Plasmodium in its saliva, then when it bites the person, when it bites the human, it will transmit the Plasmodium into the blood of the human. Okay. All right. So when we talk about the malaria parasite, there are four very prominent species that we should know of. So one is Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. All four of them cause malaria. Now, they can ask you in the exam that which is the most common plasmodium that causes malaria in India. Okay, because in India, when you check for malaria, malarial antigen, you don't check for antigens for all of these. Okay, so the most common Plasmodium species that causes malaria is Plasmodium vivax. However, you should know that the most severe one or the one that causes most amount of complications is Plasmodium falciparum. So what are these complications? For example, you may end up getting cerebral malaria. Patient has seizures and patient may have encephalopathy, or you may end up getting something which is called as black water fever. Black water fever means black water is actually a name for the urine that the patient has. So the patient starts getting hematuria, so it looks blackish in color, and that is why this is called as black water fever. Why does this happen? Because malaria leads to kidney dysfunction, leads to acute kidney injury, and this acute kidney injury is seen in the form of hematuria. All right. So these are a few complications that are majorly seen with Plasmodium falciparum. So that is why we say that falciparum is the most severe form of malaria. Plasmodium ovale, Plasmodium malariae, both of them are not seen much in India. So we will not bother about those right now. So first most common seen in India, vivax. Second most common seen in India is Plasmodium falciparum. All right. Now next is what is the incubation period of this disease? So what do you mean first of all by incubation period? So this is a human being, and imagine that he got bitten by a mosquito. Okay, so very long mosquito I've drawn, but he got bitten by a mosquito and now the plasmodium has entered into his blood. Okay, so from the time of acquiring the infection to the time that the person actually starts showing symptoms. So I'm going to show that he's crying. He has green tears, he's crying. Okay, so this is because he's become symptomatic. So this person has now started getting fever, chills, toxemia because of the malaria. So the time from actually acquiring the infection to the time from the beginning of the first symptom in the patient is called as the incubation period. So if you see, the incubation period for malaria is roughly about 1 to 2 weeks. All right. So Plasmodium falciparum incubation period is 9 to 14 days. Vivax incubation period is 8 to 17 days. Oval and malaria is more. It takes about 2 to 3 weeks. It may even take up to a month for Plasmodium malaria to show up uh, as a symptom in the person. Okay, so we will remember only for falciparum and vivax because they are more important for us. So once the person gets bitten by the mosquito, within 1 to 2 weeks he will start showing symptoms of malaria. All right. Now, what is the pathophysiology? So I have written down the pathophysiology for you all in detail over here, but I will tell you the pathophysiology first in a summary, and then we will go through the entire thing in detail. Okay. So first thing that happens is that this is the person, human being, and this is the machar or the mosquito, and the mosquito ends up biting the human. Okay. Now, this mosquito, if you see this mosquito in its saliva, it contains the plasmodium. Now, this plasmodium can be present in many different forms. Okay. So, the infective form of the malaria, the infective form of plasmodium is called as sporocyte. Okay, this is the infective form. And this is the one that is present in the saliva of the mosquito. This what I have drawn is the mosquito with the wings. All right. Now what happens is that a lot of you are joining in after the class has started. All right. So once the mosquito bites the human being, the sporocytes from the saliva of the mosquito will enter into the blood of the human being. Okay. Now, from the blood, where do the sporocytes go? From the bloodstream, these sporocytes go to the liver and they go to the spleen. Okay. Mainly, they go to the liver. Now, what happens in the liver? In the liver, you have many cells. What are these cells called? These are the hepatocytes. So, if you see in the hepatocyte, I'm just magnifying it, the sporocyte will go inside and this sporocyte will get converted to merocyte. This sporocyte get converted to merocyte. Okay. So basically the sporocyte is going through something which is called as asexual reproduction, and it is converting into a form which is transmitted all over, which is called as merocyte. Okay. So now in a lot of the hepatocytes, you will see that you have merocyte. Okay. So this happens for 1 week. That is the time of the incubation period. Okay. Now, for 1 week, these merocytes remain in the liver, and for after about 1 to 1.5 weeks, sometimes these hepatocytes will burst. Okay. So when these hepatocytes burst, so remember, if the hepatocytes are bursting over here, that means the liver is getting damaged. Okay. But this at this stage also, patient is asymptomatic. There are no symptoms. This is too early to start showing symptoms. So the merocytes form, and then once the hepatocytes burst, these merocytes are released into the blood. Okay. Now these merocytes, when they go in the blood, they try to enter into the RBC. Okay. Now once they enter into the RBC, again they undergo through many forms in the RBC.